All right, so like we talked about a little bit on Tuesday, these are just a couple videos that I think do a good job of highlighting and showing how, again, what we're paying attention to and what we're focusing on, we don't see everything that's actually going on right in front of us. Perception changes how we see things around us, and then also our visual system, it's designed to not see everything that's in front of us, but to send enough information into the nervous system, to the brain, for our brain to make the best educated guess. And the best educated guess our brain makes is going to be based off of our perception, what's guiding and steering our perception. And I think these two videos were a couple videos that kind of show how we can manipulate that a little bit. But then the question comes up, okay, so what's the importance of that from a rehab standpoint? From a rehab standpoint, how does that tie into what we talked about when it comes to the process of neuroplasticity? Because neuroplasticity in these videos is where this all crosses over. What does what they talked about, or what does what he talked about in neuroplasticity, how does that all come together? What's step one to create neuroplastic changes? Frustration. What's step two? What was it? Just first chemical is epinephrine. Second chemical is the dopamine. What's that second step though to get the dopamine? We start with frustration. What do we have to do next? Focus. We have to focus. We have to get them frustrated. We have to get them to focus on something. And remember, it doesn't matter what you have them focus on. In this video, the pickpocket, he said it several times, focusing on this poker chip. Everybody's eyes watching the poker chip. The guy on the stage with him was watching the poker chip and was right there and experiencing all of the things that were going on and didn't feel the watch come off his wrist. Didn't feel the stuff come out of his pocket. All because of how he was having his attention steered by that poker chip and touch and everything else. So from a rehab standpoint, again, if he, like he said, he watered it down and related to you as Frank. What's Frank doing? Frank can only do one thing at a time. He can see what's going on, or he can recall other stuff. He can't do both at the same time. Which, okay, what's that translate to from a rehab standpoint? How often in rehab have we seen somebody, or do we find ourselves having a patient or an athlete doing an exercise or doing a drill, and we say, how does that feel? And how many times, simple question, right? How does that feel? Easy, difficult, kind of hurts. Those are really the three first answers I expect to get out of somebody. And it's a simple question. But how often when you ask them that question, do they take a really long pause? It's like they're really having to think hard about what this feels like. It's not a hard question. Is it easy, is it difficult, or does it hurt? Why are they having to take that pause? And it has everything to do with Frank can't multitask. And we just ruined Frank's day. Because we gave the instruction of pay attention to this, do this, be successful at this. We just gave them that instruction. And then 10 seconds after we gave them that instruction, 2 reps in, we're asking them, how does that feel? I'm trying to pay attention. Hold on, I have to check. And then you've got Frank going back and forth. And that's that pause that you see where they don't know what's going on because they're trying to do the 2 things that we asked them to do. Do we even perceive that we asked them to do 2 things at the same time? We don't. We gave them an exercise. I want to know how it feels. We've asked their nervous system to do 2 completely opposing things that in the moment it can't do. Which goes back to one of the recommendations when it comes to exercise. The very first one, be quiet. Hey, do this exercise, do this drill. We're going to do 8 of these. I want to know what's going on. I want to know how it feels. Why do I want to know what's going on? Why do I want to know how it feels? Because I need to know where are they in that level of frustration. Is this super easy? Is this causing them pain? I need to know so I can either leave the exercise the same, make it a little bit more challenging, or scale it back just a little bit. I want to know that information, but I need to be patient. Because if I ask them to do something and I'm having them pay attention to it, I've steered their focus because I said pay attention to how your right big toe or your left big toe is interacting with the ground. They're focusing on that. That's the thing I asked them to do. But then if I change the direction of their focus, because now I've asked them to recall how this feels, now I've asked them, instead of them focusing on that drill, they're trying to focus on my answer, and we're wasting time with that. So the solution is do this exercise like I asked you to, but then on me, I need to be patient. I need to wait to get the information after we're done with that exercise, because Frank can't do two things at once. And if I'm asking Frank to do two things at once, I'm the reason why this drill isn't going to work the way that I'm wanting it to work. Because I steered their perception, I steered their focus to the place I wanted it to begin with, where it needed to be, but then because I asked them a question, I took their focus away from it. They're no longer paying attention to the sensations of what's going on. They're going into and they're accessing the thought side of things and the perceptions and the feeling side of things, which isn't what I need at that point in time. So a very simple thing that you'll see people do, you'll see clinicians do every single day, and then at the end wonder, I don't know why they're not getting any better. Because you're literally pulling the rug out from underneath them with a great intervention. You did all the right things, you just did it wrong. We just need to be patient. We just need to step back and let that happen. Let Frank pay attention to what's going on right now, and then when the drill's done, let Frank recall how it felt, and then we can make our adjustments after the fact. Have you guys seen this one before? Which circle's moving? Whichever one you're not looking at. The one you're looking at stays still. All the other ones end up moving. Just so you know, none of them are moving. It's a picture, not a video. But again, how the eyes work, where your attention goes, things focus in, everything else around it starts to move. This one just gives me a headache. Kind of the same thing, it feels like it's rotating all the time, and nothing I do gets it to stop. Again, just a picture, not a video, but again goes back to the visual system and how what we perceive and what's actually in front of us aren't always 100% in alignment. And it goes back to our visual system and what it's designed to do. We need to rapidly be able to take in information and make immediate changes from a survival standpoint. So, oftentimes, our visual system has to make assumptions. Most of the time it's right, but it's not always 100% right. So when it comes to the eyes, take just a second to talk about this. When it comes to the eyes, there are several recommendations that are out there to help with vision, not to help with vision, to help the eyes do what the eyes are designed to do, so that the information that it's taking in is as accurate as it can be, and so that we get used to, again, that process of input, processing, creating a motor output. Unfortunately, like a lot of things, how our lifestyles are today have a significant negative impact on this process and the ability of sensory input through the eyes, processing, and creating an appropriate action and output. And why that is because all the things our eyes are designed to do, when we stay inside, when we look at a screen, when we focus on one thing, we only do a very small percentage of what our eyes are designed to do. We're not using all the capabilities of the eyes. When was the last time, did you guys all drive to get here today? Yeah. You all probably put gas in your vehicle in the last few days or week, depending on what you drive, right? When was the last time you put air in your tires? Last time it was at the end of winter before summer, because you have to get rid of the winter air and put summer air in and stuff like that, right? I'm kidding. Usually we only put air in our tires when either we get a warning that says air pressure low or we see our tires low, right? And we do that, and we pay attention to that. We use our tires every day, we use our car every day, we get in and out of the car every day, turn your radio on every day. Any of you guys have seat heaters in your car? When was the last time you used those? Probably not recently in Missouri, because we don't need it. It's there, we're not using it. In the wintertime, we'll use it. We'll start to use all of that. When was the last time you guys checked the air pressure in your spare tire, though? Oh, it's been a minute, right? That's a part of the car. It's there. When we need it to function, we want it to have air in it. But unfortunately, because it's usually not the easiest thing to get to, it's not right there where we see it, we forget that we have the spare tire until it comes time to actually change the tire, right? And then when we do, we hope that there's still air pressure in it. It's kind of the same thing with our visual system. Our lifestyles, we're inside a lot. We're paying attention to a screen. We're either paying attention to a laptop, a presentation, a TV, our phone screen. We don't spend as much time outside. So what our eyes can do, we only use a small fraction of what our eyes are capable of doing. All those other things, we don't use them. And again, from a nervous system standpoint, those things that we don't use, eventually after a long enough time, they run out of air. Because if we're not using them, we must not need it. And then we see changes take place. And if we go back to just the picture I had up here about the cortex, 40% of our cortex is occupied by real estate that goes back to the visual system, and an even larger area is the visual association system. So if our eyes aren't doing all the things that our eyes are supposed to do, we're going to have trouble associating vision into all of the other things that we're trying to do. Vision is extremely important. So because of that, because of our lifestyle, we don't leverage and utilize everything our eyes are capable of every day. So this is a list of things that you can do every day to make sure that you're checking the air pressure in your tire and make sure that it's still there so that when you want to access it, you have access to it. First one is view things at a long distance. I look at this, I think, okay, when I was growing up, everything was a long distance. My house, it was 7 miles to anywhere. And you could sit in our backyard, and because of how the slope of the land and everything, you could see the next town away, 7 miles away. So you could sit in our backyard and you could see the town. I mean, it's not like it was huge, but you could see the outline of the town. You could see the water tower, all that. You could see things because I had 7 miles to look off our back porch. Here, we can't see that. If we just look out the window, you guys probably can't, I can. I look here, I can't really see more than 100 yards because I've got trees, I've got buildings, I've got the bear sign. Furthest thing I can see from here is the top of the church, which is about a block away. So when we're inside, if we don't use the window, the furthest away we're looking is 25, 30 feet. Why that's important is because for the lens of the eye to actually focus on that thing that's far away, the muscles of the eye have to reshape all of that. And then when I look at something close, the muscles of the eye have to reshape again to allow me to focus on something close. If all we do is focus on things close, our ability to change that, to change the shape of that lens goes away. So it makes it harder for that to take place. So 10 times a day, the recommendation is just to look at something that's a long ways away, just to get that to happen. Natural lighting after you wake up. This one's a really big one running around the internet. If you want to get up, if you want to get better at resetting your circadian clock and get to where you can turn yourself into a morning person, you're supposed to wake up, and within 10 minutes of waking up, you're supposed to be outside and see 100,000 lux of natural light. And that's just a measure of light. And they have fancy apps on your phone that you can download that tell you how much light is coming in. And it's really not that bright. But the recommendation is for you to get up and get as much natural light into your eyes as you can within the first 10 minutes, because then your circadian clock starts to reset. Remember the suprachiasmatic nuclei that sits right above your hangy bang in your throat? That's light enters your eyes, it goes to that. Hey, the day's starting, circadian rhythm starts. And it starts a circadian rhythm for the day. Do that 3 or 4 days in a row, and your circadian rhythm actually starts to shift and predict that. And so what will end up happening is, for the last 3 or 4 days, I've gotten up at 5:30, not really, an example. Last 3 or 4 days, I've gotten up at 5:30, take the dog outside, spend 5-10 minutes outside, getting all the light in my eyes. Starting on day 6, I wake up a couple minutes before my alarm clock, because that circadian rhythm that changes cortisol levels, which cortisol and melatonin levels, which determine wakefulness, cortisol levels are going to start to rise, which is what wakes us up. So the hormonal changes that come along with the circadian rhythm will automatically start to happen, because we've started to reset that suprachiasmatic nuclei, and it starts to predict that. See the horizon for more than 10 minutes a day. Again, that just allows us to have that panoramic vision, where we kind of take that far off look and we kind of take in a lot of different things versus something that's really close and that we're focusing on. Optic flow. You guys know what optic flow is? It's the flow of the optic system. Does that help? You experience it when you're walking. So as you're walking, all the things that are passing by you, that's optic flow. You get it when you're walking, you get it when you're riding a bike, you get it when you're driving in a car, riding in a car. This is why if you get car sick, this is part of that process is how your brain is interpreting and processing the flow of those objects as you're going past it. Then smooth pursuit. There's I don't know what it's on now, it's probably on all the social media channels. It originally started out on YouTube. The cat that's watching the table tennis ball go back and forth, you just see the cat's head moving side to side. Optic flow is just where we visually track things. We see this in sport a lot. Quarterback throws the football and you're just watching the flight of the football. You know, tennis, the ball going back and forth, baseball, basketball, watching the flight of the ball. Smooth pursuit, tracking of objects with the eyes. If you go through all of that and work on that every single day, or incorporate that a little bit into every day, you're going to, as best we can, maintain all the functions of what the eye is able to do. If you're stuck indoors, the recommendations are every 30 to 90 minutes you look up from what you're working on. We typically hear this a lot. If you're sitting on your computer, you're typing all the time, every 30 minutes, every 90 minutes, you need to spend 5 to 10 minutes looking at something other than the computer screen. Again, just so that the muscles of the eye, the lens of the eye can accommodate and change. Every 90 minutes, get outside or at least look outside. That allows us in to start looking at things at a distance, maybe even see the horizon. And then the last thing is that near-far accommodation. We do this every fall. We pay attention to this. We don't know that we're doing this. Some of you guys might have done it in the last couple days. Some of you guys might have done this in the last week and not even known it. All right, I want you to track my pen. Concussion assessment, So when we do this is the smooth tracking side of things, where we're tracking the eye. And what are we looking for? Nystagmus. We're looking for the eyes to be jerky, because we see that, we think symptom of a concussion. We have a tracking issue. Well, why do we have a tracking issue? Because the muscles of the eye aren't smoothly doing what they need to do. So after the appropriate mechanism, we associate that, and that's a sign of a concussion. Outside of a concussion, that's just smooth tracking. We do this, and eventually we do this one, right? That's the near-far accommodation, being able for the eyes to diverge and then come to a confluence right out in front of the nose. Again, all about the muscles of the eyes, the lens of the eyes, being able to do the things that they're doing. If you're tired, I talked about this briefly last time. If you're tired, 2 things that can help make you be a little bit more alert is bright light, and then just the simple act of looking up. I'm not 100% sure why the simple act of looking up does it, but looking up, doing bright light will help increase your alertness. Lots of resources out there. This guy is a professor out at Stanford. I think his entire background is he's a neurobiologist, I think, focusing on vision. I think that's right. He has a podcast that takes a really deep dive into all that stuff. If you're more interested, you want some of that stuff explained more, just search for it up on Spotify or Apple Podcasts. You can find it there or wherever. All right. No, we're not going to watch that whole thing. The limbic system. This is the last part of what we're going to talk about in regards to the nervous system. Do you guys remember the limbic system from anatomy class? Be honest. No, not at all. If I said, okay, you kind of remember, can you give me all the parts of the limbic system if I took away their names? The answer goes from I kind of remember limbic system to no, not at all, right? Again, because when we're taught this in our anatomy classes, we're taught it from a you need to learn this because this is a part of the body standpoint. We're not taught this information in regards to what this means from what we're going to do every day. How does how does the limbic system influence what we're trying to work on with our athletes, with our patients every single day? What we need to understand about the limbic system, all of the sensory information that's coming into the body is processed and passes through the limbic system. So all of our senses except for smell pass through the limbic system. So what's going on in the limbic system is going to influence all of those sensations. All of the sensations that we take in are going to at the same time influence the limbic system. The biggest importance of this is the hormonal response that it creates. And I think, personally, I didn't understand that enough until very recently. Because we think about movement, okay, this muscle does this, that muscle does this. If we expose the bicep to this long enough, we're at a cellular level, we're going to get this, and this. The muscle's going to get stronger. We do flexibility stuff, we can increase the resting length, we do manual stuff, we can change, the collagen that's there, we can influence the fusion, we can influence swelling. At any point in time, did anybody talk to you about how we can actually change and affect the hormonal responses of the body? No. Why is that important? Well, let's just rewind 1 week in class and talk about neuroplasticity. What's the first chemical that has to be released for neuroplastic change to take place? Epinephrine. What's epinephrine? Neurotransmitter. It's adrenaline. We have to have that. Epinephrine leads to dopamine. Dopamine leads to acetylcholine. We get all of those releases. We have to understand that from a movement standpoint, our brain doesn't recognize movement. Our brain recognizes the chemical makeup of what's going on from the neurotransmitters, the hormones, all the other important things that are up there that are released based off of how we move, what we're doing. So our brain recognizes movement through the chemical makeup of what's going on within our brain based off of what that movement released, what that movement caused. So first thing we're going to talk about is the amygdala. Have you guys heard about that one before? The amygdala is associated with fear. It's one of the reasons why when we have a traumatic episode where we actually are scared, that typically sticks with us for quite a while, and it's hard to work past that, get past that. Where do we deal with this in regards to the world of athletics? That athlete that just tore their ACL. They tore their ACL, they had a traumatic episode, they had a high level of pain. Now, from a rehab standpoint, 5, 6 months down the line, we're trying to get them back to basketball, they're still hesitant to cut. They're still hesitant to put their foot into the ground and plant because that's how I tore my ACL. And now I'm associating the immediate pain that I had, the loss of being able to do what I want to do for the last 5 or 6 months, the rehab, the pain from surgery, the time I've invested, and now you want me to do the same thing that started all of this. That's driven by the amygdala, because the amygdala Because when those sensations passed through the limbic system, the amygdala tagged that. And so now, the only way, how do you think we get past that? Let me ask you this. That's the situation, that's the athlete. How do we typically get past that? More repetitions, right? Let's just, more repetitions, more repetitions, more repetitions. Do more repetitions by themselves work? Let's go back to neuroplastic changes. Is step one more repetitions? No. Step one is we have to get the epinephrine release. So we have to find a way to create neuroplastic change in a positive way to overwrite what that amygdala burned into their reality when they tore their ACL. We have to find a way to safely and effectively introduce this to them, that thing to them in stages, to where we leverage a neuroplastic change. Because the only thing that's going to overwrite what's going on from that amygdala, from that initial episode, is to actually create changes to replace that. And that's not just done through sheer repetition alone. It's not done through sheer trial and error alone. And that's one of the reasons why oftentimes that's a very frustrating time of rehab, because we just do it. You put your foot in the ground, you plant, you go that way. It's a simple thing. Why can't we do that? And we don't give value to what the amygdala started on the day that they suffered their injury. Hypothalamus. You guys remember this one? Important thing about the hypothalamus is as seen as a suprachiasmatic nuclei, the little thing that sits right above your hangy-bangy that starts the circadian rhythm. Hypothalamus is very influential. It's tied to sleep. We have issues with the hypothalamus. It makes accessing sleep, it makes falling asleep, it makes staying asleep difficult. Why is sleep important? What's the third step of neuroplastic change? Sleep. So we have to give value to that and understand that this is tied into the hypothalamus. Pituitary gland, you guys remember this one? Kind of, no? This is the master gland. This is what determines a lot of different hormonal releases. Growth hormone, oxytocin, endogenous oxytocin, both of them are controlled, the release of both are controlled by the pituitary gland. Both are very important when it comes to what people are feeling and the sensations that they're having after an injury. Somebody has surgery. Often made a joke that the first few days after surgery is the best time to work with somebody, because that's when they have all the good medication in their system. They still have the leftovers from the general anesthesia, the medication they put into that. They still have the nerve block going on, and they send them home with a prescription for oxytocin, some high-level typically high-level medication, maybe even to the level of a narcotic, to control the pain. How do we access pain control outside of that window right after surgery? Somebody comes in and their knee hurts. What can we do? What can we do to make that knee stop hurting? Because I'll go back to, said it a couple times. Somebody walks in the room, the only thing I have with me are my hands and my clicker. Can I treat the person? Absolutely. If I can't, I shouldn't be employed here. What can I do with my hands and the clicker to make the pain decrease? Because there are things that we can do. And it goes back to creating an endogenous release of oxytocin, which goes back to leveraging the pituitary gland. How do you guys think we can access that? Breathing. That's why nasal breathing is so powerful. Nasal breathing allows us, that's why meditation has, if we think back, or if you think about meditation and yoga, both very popular. Hypnosis. Did I talk to you guys about the Reverie app in here? Somewhere? Yeah, self-hypnosis. Why do people go through and do that? Well, they're trying to manage pain. They're trying to control pain. Well, how does hypnosis control pain? Are they going in, they're hypnotizing you, and they're saying your knee doesn't hurt anymore, your knee doesn't hurt anymore, and you believe that their knee doesn't hurt anymore? It has nothing to do with that. It goes back to the nasal breathing and what the nasal breathing does within the nervous system, to shift us from an autonomic response or a sympathetic response to a parasympathetic response first and foremost. But then also nasal breathing, for some reason, the process of nasal breathing and focusing on your nasal breathing actually releases endogenous opioids within the system. Anything that we do that's pleasurable releases endogenous opioids. So, listening to music, reading, working out. When people say they like to go run and they get that runner's high, what's that runner's high? It's an endogenous release of opioids, endogenous release of oxytocin. So somebody's torn their ACL and their knee's hurting, we can't say, oh, you like running, go for a run. Can't leverage that. What can we leverage? We can leverage nasal breathing. We can leverage deep pressure. Deep pressure also has a response of releasing endogenous opioids, which is why massage tends to help people feel better. Because it's not because of the actual, I'm just rubbing on your rectus femoris and that makes you feel better. That's going to obviously create a local improvement in how that feels. But why do people feel better, like as a person, after massage, after yoga, after Pilates, stuff like that? It goes back to that endogenous opioid release, which again comes from the pituitary gland, which is why breathing is so important. The pineal gland, part of the hypothalamus. This one's tied into our circadian rhythm. This is where melatonin is released. We're having a conversation about melatonin. We know that that's going to come back and have some kind of tie-in to our sleep patterns, wakefulness, which again go back to neuroplastic changes. Step 3 of neuroplastic changes, go to sleep. Thalamus, this is the relay station. All the sensory input passes through the thalamus, except for the sensation of smell. Smell is the oldest sensation that is associated with this, so it bypasses the thalamus. All of our other sensory input passes through here. Visual input, touch input, spatial awareness, all of that hot, cold passes through the thalamus. So the thalamus is getting and filtering all of the sensory information. Because of that, sleep and wakefulness is very important when it comes to the thalamus. Our level of how quickly we can learn, our ability to retain information with memory is very much tied to the thalamus. And again, the importance of the thalamus is because that's again where all of our sensory information, pick any sensory information, it's passing through, it's going to the thalamus before it gets to the cortex. It has to be filtered out through the thalamus first, which then goes back to why is this relevant? Okay, we talk about all this stuff. Well, what can we do about the pineal gland? Not a whole lot. What can we do about the thalamus? Not a whole lot. What can we do about the amygdala? Not a whole lot. But we have to understand with this that movement is an action, movement is a behavior. It's influenced by emotions, thoughts, perception, but at the same time, our movement influences our thoughts, perceptions, and emotions as well. So it's kind of a double-edged sword with that. We can change things with movement, but movement also is changed by those things going on in our head. And since all of our sensory information is passed through the thalamus, if we think about everything else, it's all about releasing things. So information comes through the thalamus, and that leads to the pineal gland to release what is appropriate for what we're experiencing. Sensory information is coming in, we're tying that fear, that pain that we just experienced because of the amygdala. it's going to flavor that as we move forward. So we have to understand that movement as a behavior is going to be heavily influenced by everything that goes on in the limbic system. And the most important thing that goes on in the limbic system in regards to movement is the hormonal response that it creates. The hormonal response that movement creates. Because that's what the brain recognizes as movement. The chemical makeup, the chemical soup that is associated with that. Second, all of our reflexive tasks. This term drives me nuts. Reflexive midline stabilization. There's only one true word in there, midline. If I ask you what midline is, we're all going to say probably something in the middle of our body, correct? That's midline. We can agree on that. What's reflexive? What's stabilization? It's a great sounding term, but it doesn't mean anything. And we have, and in our world, in the movement world, we often hear the term reflexive thrown around. But I think it's important to understand that there's only a certain amount of ways, a finite amount of ways that we can actually have reflexive actions. First, we actually have the reflexes that occur through the spinal cord. We're familiarized with these, we are associated with these when we learn our assessment. What are they? How do we test these? How do we assess the spinal cord reflexes? We pull out the reflex hammer, we tap the patellar tendon, and we look for it to respond. We put our finger in the biceps, we tap the biceps tendon, we look for it to respond. Triceps, we can do the same thing. Why do we check that? We've all learned this, but let me ask you this question. You test somebody's patellar reflex. On the left side, it's wonderful. On the right side, it's absent. What does that tell you? Because here's the thing, if you don't know what it tells you, there's no point in doing the test. And there's a lot of people out there that are doing a lot of tests, that they do the test to get the information, they don't know what the test tells them, they're just wasting their time. So when we talk about reflexes, we're testing that spinal arc. So if I'm testing my patellar reflex, and I'm taking out the reflex hammer, and I'm tapping and my knee does that. What we're assessing with that, we're assessing, I create the stimulus into the anterior part of the knee. I'm testing the afferent nerve pathway that goes from my patellar tendon up to my spinal cord. Is that sensation being carried up into the spinal cord? At the spinal cord, it's going to cross over. The spinal cord makes its decision because it's a reflex. Hey, I need to respond like this. It's sending out an efferent, a motor response that says we need to twitch the quads. That's all we're testing. We're testing the pathway from the patellar tendon to the spinal cord. We're testing the sensory pathway. We're testing the motor pathway back. We're testing the integrity of the spinal cord at that level. That's all we're testing. We're testing local things when it comes to our reflexes. You're not testing the brain because it never makes it to the brain. That's why it happens so quickly. That's what, if you try to not have the reflex, you still have the reflex because it happens below conscious control. And it's kind of hard to get yourself to have your own reflex. I don't know. Apparently I don't have the pathways, but it happens, and it happens so quickly because it doesn't have to travel all the way up to the brain. It doesn't have to pass through the limbic system. It doesn't have to go up and become processed and make, okay, well, this is what's going on. We need to process it. This is the outcome we need to do, and send it all the way back down. It happens immediately because it's happening at the spinal cord level. That's reflexive. Is there a clinical reason to do reflexes as part of rehab? Let me ask you this. Somebody comes in with anterior knee pain. Have you ever seen a clinician that says, okay, anterior knee pain, today we're going to work on your reflex arc? No, you haven't. There's really no reason to do that, because all we're doing, I mean, technically if you wanted to just continue to make sure that that's working, yeah, you could do that, but I don't know why you would want to do that, because when we're talking about movement, conscious movement doesn't happen at the spinal cord level. Conscious movement happens in the brain. It's good from an assessment standpoint to make sure that those structures are functioning the way that they need to, but that's about it. So that's one of the reflexive things that we encounter. There are reflexes that occur in the brainstem that you all are leveraging right now, and you're probably pretty happy that you're leveraging them right now. Breathing is a reflexive action that we don't have to think about. It's controlled in the brainstem. Your heart rate, your blood pressure, your stroke volume, your resting heart rate, all that happens and is controlled reflexively at the brainstem. It doesn't require any conscious thought. Now, breathing is kind of unique because if you're not paying attention to it, it happens, but we can actually control our breathing. So breathing is the one thing that happens automatically, but we also have conscious control over it. That's where the power of breathing is so high, because it allows us to manipulate much lower areas of the brain, the brainstem and the limbic system. It allows us to leverage the other functions of those areas. Right now, just sitting here, can you increase your blood pressure? Consciously think about increasing your blood pressure. The only way you can do that is, I can't sit here and think, okay, diastolic needs to go up. That's not going to increase my blood pressure. What will increase my blood pressure? Thinking about clowns. And the reason my blood pressure increases is the fear response that thought creates. But I can't consciously say, I need to increase my blood pressure. I can consciously say, I need to take a breath, and I take a breath. I can't sit here and consciously think that I need to increase my heart rate, or that I want to decrease my heart rate. But I can create an increase and decrease in the heart rate by what I'm thinking about. I can also lower my heart rate through nasal breathing strategies. Again, breathing allows us to take control, a little bit of control, over those lower areas of the brain where reflexive actions actually are occurring. And then the last one, the last reflexive action that we actually can leverage and take advantage of in the rehab world is the one that we don't even acknowledge as a reflexive action. And we see this happen every single day. There's an entire section of rehab that's completely devoted to this, and we don't acknowledge it. We don't know that it's devoted to this because we call it gait training. Our central pattern generators, our walking, those things that just happen. When you walk, are you thinking about walking? No, because it's happening below your level of conscious thought. Can you think about every step that you take? Yes, it's happening at a higher level. That's one of the reasons why gait training is so frustrating and unsuccessful, because we're trying to put all of these things together at a conscious level. I want you to step over the hurdle, pull your toes up, make sure you straighten your knee all the way up. When that knee's all the way straight, I want you to put your heel on the ground, keep your toe pulled up, and then you're going to slowly shift your weight forward. Who walks like that? Nobody walks like that without getting made fun of or laughed at. So, but we think if we address the higher consciousness of gait, that it's going to affect the subconscious side of things. That's not how it works. It's why gait training doesn't work. Gait training is very, very frustrating. If you do it enough, you will create change. But the change that you create is at a completely different level in the nervous system. It's not going to have the effects that you want. And again, let's go back to what we've talked about before. We can create that adaptation over time and frustration, or we can access neuroplastic change. One's more effective than the other. Okay, so gait training is important. That is kind of a reflexive action. How you guys are sitting right now, Are you paying attention to how you're sitting and what muscles need to do this, what muscles need to do that? No, it's a reflexive action. It just happens below conscious level of thought. All of our postures are controlled by our central pattern generators, reflexive actions, which is why the assessment, the part of the assessment that we covered last semester was the movement profile. What are we looking at in the movement profile? We're looking at 21 different variations of the standing posture, because I want to see how your nervous system works out the specific set of confines I gave you. I want to see how your nervous system, what your nervous system gives me as the best solution to the problem when I say, put your feet hip width apart, rest your elbows on your knee. I've given you a specific set of instructions. I want to see how your nervous system puts all the pieces together and does that. It gives me an idea of what's going on reflexively in regards to those central pattern generators. Can we leverage that? Can we access that? Can we put them in a position to where we can magnify and change all that? Absolutely. But we're not just working on the bottom of the deadlift shape. We're putting them there and asking changes to take place, which opens the door to a different way of approaching gait training. Slowing down the gait cycle, overemphasizing the gait cycle, it's going to be frustrating, because slowing things down isn't necessarily the best way to make movement better. Oh, reflexive, we talked about this one, the bird dog. People love the bird dog, and just so you guys know, if I talk about an exercise and you really, really like the exercise, I don't see any exercise as good or bad. It's all in how you apply the exercise. Where I will point out faults isn't with the exercise itself, but in people's perceptions and thoughts about the exercise and how they leverage that. So I don't want you to walk away thinking that Brandon said this exercise is stupid. I'm not saying that. I just want to point out better ways to understand the exercise and point out that how things are typically presented to us aren't necessarily the actuality of where the benefit lies. Bird dog exercise can be a good exercise when it's used correctly. What do we use it for? If you were going to use the bird dog exercise, why are we using the bird dog exercise? What are we trying to improve? What was that? Stability. Core stability is, you ask 100 people, 99 are going to say we're working on core stability. Can't define what the core is, but it'll be core stability. So if you go and you read the instructions on how to do a bird dog, which there are actually instructions on how to have somebody do the bird dog exercise. Where is it? I pulled this up from an article in Men's Health that was devoted to, the whole article was about the bird dog and how to do the bird dog. And these are the instructions. The bird dog is at its best when you're intentionally and very focused on every movement. Focus on keeping your torso fully parallel to the ground, hips and shoulders always square. So if our goal is core stability, stability is the ability to react to what's going on around us. If that's my goal, to react to what's going on around us, and in my instructions for the bird dog, keep your spine parallel, your shoulders and hips square, and very intentionally and very focused on every movement, how much stability are we actually creating with that? We're not. Again, like the example I gave before, I want you to do this exercise, I want you to focus on this, and then 30 seconds in, I'm asking you what you feel. We're putting Frank in a situation where Frank can't do his job. Not because Frank can't do his job, but because we're asking Frank, what we're doing is making Frank not be able to do his job. We're putting him in a situation to do one thing, but how we're doing that is creating the complete opposite. And it negates all the benefits. So again, I think the bird dog is a great exercise. These instructions, if you give people instructions on how to do the bird dog, I would get rid of all of those instructions. Because those instructions negate the whole stability side of it. It can't be reflexive if it's happening at the cortical level. The only way it can be reflexive is it's happening at a much lower level. And if we're consciously paying attention to what's going on, that's happening at the cortical level. which is also why a lot of our core stability drills have no shot at working because of how we put people into positions and the instructions that we give them. It might be a great drill, but we ruined it by how we set it up, by how we gave them the instructions to do that. Go ahead, real quick, get down into quadruped, so down on all hands and knees. We might have done this one last semester, I don't remember. I do this all the time. It all starts to run together for me. Down on your hands and knees. All I want you to do, hands stay on the ground, feet stay on the ground. I want you just to hover your knees 2 inches off the ground. Hover them up, take a breath, put them back down on the ground. Do that 2 or 3 times. Not too bad, right? Now, while you're doing that, I want you to pay attention to what's going on right in here. So do the same thing you were just doing, but I want you to pay attention to what's happening right around belly button level. Do that 2 or 3 times. What do you guys feel with that? What was it? Contracting. You feel things contracting, right? Do you feel that? You feel them contracting when your knees come off the ground, correct? And when your knees go back on the ground, what happens? They relax. So your knees come up, this area contracts. When your knees go down, this area relaxes, right? This is what I want you to think about doing. Do not contract any muscle between your pelvis and your sternum, okay? Go. Consciously think about relaxing those muscles and hover your knees off the ground. Anybody able to do it? So you guys all suck at this exercise. You can't do it, I'm asking. It's not that hard. Just think about, don't relax this area, or don't contract this area. It's not hard. Just relax. You guys can hop back up in your seats. There is no possible way to do that drill without those turning on. There are no words that I can give you. There are no instructions I can give you that will actually accomplish you not turning those on. That's happening at a level below cortical control. We can't control that. Why is that important? How many times in therapy do we do things and we just say, just relax? Here's the thing we have to remember. If they could relax, they would be relaxing. The fact that that tension is there and it can't go away, it's not, your words aren't going to make it go away. Goes back to top-down versus bottom-up processing. In that situation, in this situation, there's no possible way to get these to relax. If we're dealing with somebody and they're bringing, we're just trying to work on elbow extension, their biceps is always on, we're just trying to tell them to relax. We can't use top-down processing to get the biceps to relax. They can't think about the biceps relaxing because you guys can't think about this relaxing. We have to use bottom-up strategies. Bottom-up strategies being actual tissue-related strategies. That's where our manual work comes into play. We can do manual work to dial down that tension. We can't verbally tell people to do that. That's because now we're getting into different levels of the brain. Feed forward versus feed back. Both are really good strategies. Feed forward. Feed forward would be if we do that same drill you just did before, and instead, the instructions I gave you, down on your hands and knees, hover your knees 1 inch off the ground, take a breath, put your knees back down. Those are the instructions I gave you. If I wanted to give you a feed forward strategy, it would be, okay, down on your hands and knees, contract your abs as hard as you can, hover your knees. You're contracting your abs. You're consciously thinking about contracting the abs. You're bringing tension to the table regardless of how much tension you need. You're going to contract your abs, put your knees back down on the ground and relax. That's feed forward. That's the, you see the people, valgus knees? Feed forward is, I want you to press your knees out and keep your knees pressed out the whole time. I don't know how much tension I need, but I'm bringing as much tension as I can. That's a good strategy. That's a good awareness strategy. But remember what awareness is. Awareness is step one. Awareness is the thing that guides our perception. It has its place. but it's a very low level, it's entry level. The bird dog, those instructions for the bird dog. If this is the first time you've been doing the bird dog, I might give you those instructions. But if I do, I have to understand I'm not working on core stability yet. I'm working on awareness. I'm giving you feed-forward tactics and strategies to create a false sense of stability. I'm creating stiffness. Stiffness and stability are not the same thing. And so when I tell you contract this, and so think about that from a rehab standpoint. How many times do we say during an exercise or before an exercise, squeeze this or contract this? Anytime we tell somebody to do that or give that instruction, however we do it, we're leveraging feed-forward techniques that is appropriate, entry-level wise. Feed-forward strategies work amazingly well when we know exactly what's going to happen. But there's only one sport where we know exactly what's going to happen. There's two sports where we know exactly what's going to happen. The 100-meter sprint has to be the 100, because after 100, if we're going to run the 200, there has to be a curve, and you have to run the curve. And every step, we're having to find a new center of balance because of the curve. 100, we're going to run straight ahead. And then Olympic weightlifting. We know the bar is going to go from here, it needs to go overhead. It might not always go there, but the path that that bar is going to take is always going to be pretty much the same. If we fail, we miss the lift. In football, there is nothing where feed-forward strategies work. Because in football, as soon as the ball snaps, we don't know what's going to happen. Here's the play. This is what I want you to do. How often does that actually happen? Never, because there's a defense. So feed-forward's great. It's basic level. I need you to, it's good to bring awareness. I need you to squeeze your quads. I need you to squeeze your glutes. I need you to squeeze your abs before you hover your knees off the ground. We bring stiffness to the equation. That stiffness is what generates the false stability that we have. And if somebody doesn't have any way of generating stability, it's a good way to do that. But again, if we go back to the cortex, which is bigger, the visual cortex or the visual area or the visual integration area? The integration. Which is bigger, the premotor cortex or the motor cortex? The premotor cortex. Those integration areas are bigger for a reason. We have to integrate. And so when we just say squeeze this, we're not integrating. We're bringing awareness. And so what that turns into, the drill that we just did, if I'm using that drill as a core stability drill, hey, we're going to do this. Right before you hover your knees, I want you to squeeze your abs as hard as you can, hover your knees just barely an inch off the ground. That's what they're going to do. But then it's okay. Now, if what you were doing before, that was a 10, I want you just to give me a 5. We're going to squeeze a little bit less, and a little bit less, and a little bit less, until finally we get to, okay, I want you to keep this as relaxed as possible. And things are then going to still turn on appropriately. Because so real quick, last thing we'll do, get back down into that quadruped position. Get back down into quadruped. Do this as a feed forward drill. Squeeze your abs as hard as you can. Try and cramp your abs like you're doing a sit-up. As hard as you can, hover your knees. Just do that a couple times. Now when you do that, you feel the tension in your abs, right? Do you feel those little things turning on that you were feeling before? No. Do it 1 or 2 more times. Contract as hard as you can. Try to feel those things that were turning on and turning off. See if you still feel that happen. Feel that happening at all? No, because you guys can relax. Those little muscles that are supposed to turn on and turn off to create the deep spinal stability, we've shut those off because we've brought all these prime movers, all these big muscles, we brought all that tension to the table. Those little muscles can't do the things that they're supposed to do. So 2 completely different ways of creating stability. One is integrated, one is reactive and responsive, those little muscles that have to turn on at the right time to do their job, versus that stiffness that we're bringing. 2 completely different strategies. If I ask you to bring all that stiffness to the table and contract this as hard as possible, and then I ask you to do something else, take your left arm and reach it forward, your ability to do that's going to be impaired. Because all of this has to stay tight. Now you're adding another variable. I can't keep all this tight and reach at the same time. Versus those little muscles that turn on and turn off at the right time, that's going to give you that ability to integrate that into what it is that we're doing. So feed forward's a great way to start. Too much of that brings stiffness. We eventually have to get to feedback where we're actually responsive, where we're not telling people to turn things off. In fact, we're telling them to stay relaxed. Stay relaxed while doing this, because then they have to be responsive to what's going on. All right, any questions about any of that stuff? Don't forget, that's all I have to talk about today. Don't forget that the article on the patellar tendon, your first